Welcome to the Life's Best Medicine podcast, where we are finding hope and healing one episode at a time. No appointment needed, no rubber gloves, and no coping. Just a healthy dose of life lessons to help equip you for this wild journey we call life. Hey everyone, this is a friendly reminder that we are here for entertainment purposes only. We may not even be that entertaining at times, but this is not medical advice. Talk to your doctor, check with your healthcare professionals before making any lifestyle changes or medicine changes. What we're talking about is our clinical experience and what we've seen. And so if you really want our advice, you can consult us. You can actually consult me as a doctor, or you can consult my guest and get all your questions answered. But we can't give free medical advice because we can't pay our bills with that, but we can help to educate you a bit and allow you to think a little bit, and always reach out to your medical professional before making any lifestyle changes. Thank you. Hey everyone, as promised, December crept up on us again this year. I gave you warning all throughout the year that this was coming, so don't act surprised now, but this is a great month. We have some great guests coming on. One of my favorite people, Ben Bickman from Health Code, who happens to be one of the sponsors, is joining us. And I think you'll really enjoy hearing what he has to say. Health Code, great stuff to help you get back on track or to minimize the damage during the holidays. Tons of shakes and recipes. Go to Get Health, GETHLTH.com. And the discount code is METHEALTH, METHEALTH. So go there, stock up for next year when you're trying to get back on the wagon and get back into those pants and shirts that are too tight. We don't want to lose buttons this year, guys. We gotta really do it next year in 2024, big year. Also Keto Mojo, thank you so much. They're doing such great work, and go to their website, keto-mojo.com. They have a ton of information there, old talks, just a lot of information. Also, at the end of the year, they also have health savings account. If you have money in those accounts, you could use that. In most cases, check with your advisor, but you could use that for Keto Mojo to see what your ketones and sugars are looking like at the end of the year. So everyone, thanks for your support. Thanks for listening, and enjoy the podcast. Hello and welcome back to the Low Carb MD podcast and Life's Best Medicine podcast, because this one is going to be good and I want everyone to be able to hear this. I don't want anyone to miss out. The great one is here, Dr. Jason Fung. Awesome, man. Everyone, if you don't know who he is, then you've been living under a rock. Jason's done so much. Like every guest we have on says when we ask them who their biggest influence was, who got them started, Jason Fung. It's like universal. Like we already know the answer before we ask the question. So this is a doc from Canada who's a nephrologist and really brought fasting back in, low carb, talking about insulin resistance, all this stuff. I remember when I first talked to him, like, who is this guy? And then I'm like, holy cow, everything he's saying is true, what I'm seeing clinically. And then also he has the amazing skill of getting a complex medical system and explaining it in a way where people understand there's no one better. So Jason, welcome. It's so great to have you, Doc.
Hey, thanks. Thanks for having me, Brian. Good to see you again.
Great to see you. What's happened? Give me the lowdown. The reason I'm having you back on right now is one of my patients said, "Oh, I'm reading Jason Fung's new book and it's helping me." I was like, "What are you talking about? I didn't even know about it." So, like, you've
It's not
released more
really a
books
new
than anyone.
book. It was sort of a follow-up to the diabetes code. It was a journal because there's been a couple of new developments in diabetes. So just to back up, so diabetes, type 2 diabetes is like a huge problem. It's really the one issue that I feel sort of most strongly about, because as a kidney specialist, I see a lot of diabetic kidney disease. In fact, it's probably the majority of what I see. And the reason it always bothers me a lot is because it's a completely sort of preventable disease. And the way that we treated type 2 diabetes for years was just all wrong. And I did it for 15 years. It was all wrong. And we took this disease. So we said it was chronic, it was progressive, and then we gave people a bunch of medications. And in those days, of course, it was mostly like sulfonylureas, metformin, and insulin. We have newer ones which are actually quite good, but those old ones were not. And the reason it bothers me, once I started to look at it differently, is that it was always understood as a dietary disease, right? So everybody knew it, everybody. Yet the doctors, like me, were basically taught that it was chronic and progressive. So there's nothing you do but give medication. Yet at the same time, every doctor, every nurse practitioner, every diabetic specialist, every patient knew that if you lost weight, then your disease would either get better or go away. So it's like there was this sort of dichotomy between we know it's reversible, but you have to lose weight. Yet as doctors, we were saying, well, it's chronic and progressive. Let me give you these medications. And it's like, well, if it's a dietary lifestyle disease, then you can't fix it with a bunch of drugs. You need to fix that diet and lifestyle. So it was basically all wrong. So that was the whole premise of the diabetes code. And that was one of the sort of times I felt really bad, because it was like, oh man, I've been treating it all wrong for like 15, 20 years. I've been treating it all wrong. And everybody was. But that's my job, to treat people, and I was doing it all wrong, right? That's not, it's sort of acceptable. So that's why I started talking about it a lot. And then so that came out. In fact, after that, the American Diabetes Association actually in 2021 finally published criteria for remission, which means that it's basically admitting, without saying quite so, that it is a reversible disease. What we said all along, that it was chronic and progressive, which was on the ADA website for like 10 years. I know, because I have screenshots of it. It was all crap. It was a giant lie. It was a big lie. That's all it was. So, so now if it's a reversible disease, we should be focused on reversing it. And that's what people like Virta Health and a company I'm working, also a program I'm working with, which is called Level 2 Health, which is part of United Health, are working at getting people not to manage their diabetes, is to reverse their diabetes. Okay, so Virta Health is doing great work, and they've done a bunch of studies, and they show that absolutely it's you can do it. Dr. David Unwin in the UK, he published his results. He's a GP, and he published his results, and it was ridiculous. So he put people on a low carb diet, and he put 50% of the people that followed his diet into a drug-free remission. So that's insane. Like, that's so amazing to have
And
half the
Jason,
patients.
just a step back. This guy was on the front pages of the newspaper all the time saying this guy's dangerous. He's going to kill people and all this. I mean, he really took heat, and he's the nicest person on earth,
The
right?
nicest guy. Yeah,
And
he is
so,
amazing.
and you see what he's doing. He cares about patients. He was ready to hang it up because he was so frustrated with not helping his diabetics. And then one of his patients taught him, like, just like you taught the rest of us. But it's amazing, that this little guy in a podunk town in the UK, and where there's sheep roaming the hills and everything, and then he changes medicine, right? And guys like you who really have this influence.
Yeah, it's amazing. So David, in fact, David's working with me at Level 2. So what happened is that 50% of patients, right? So, basically reverse their disease. That's an incredible life-changing event, because that type 2 diabetes puts you at risk of heart disease, strokes, cancers, peripheral vascular disease, amputations, kidney disease, blindness, nerve damage, the whole works.
Yeah,
Like, and he
dementia,
just,
depression, like all these neurologic
yeah, and
things too, right?
crazy. It's like the crazy amount of problems you get with type 2 diabetes. And he just basically cured them, right? It was like ridiculous. 50% of patients. So that's what's possible. And Virta also had amazing results, right? They published theirs, and they also had amazing results. So, this whole thing, one of the biggest diseases in the United States, and it's completely reversible, and you don't need drugs, and you don't need any money, and you don't need any cost. You just do it. So so United Health also had a program called Level 2. So I'm helping with them, and Dr. David Unwin is also helping with them, and his wife Jen Unwin also helping with them. So as a psychologist, and basically we're trying to put together a program that is going to be available to everybody. So if your employer sort of signs up for it, then you can just get level 2 if you're type 2 diabetes. And what they'll do is, we're training people, nurses and stuff, to do low carb, to do intermittent fasting, time restricted eating. We're going to give people a CGM. And then the other thing that is very useful is to write things down. So this is what the Diabetes Code Journal is, which is the book they're talking about, which was a journal that I put out, I think, earlier this year. And it was basically a workbook. So there's these new technology called the continuous glucose monitor, and a lot of people have heard of it. And they're very, very good. So you basically put the sensor in and they'll give you readings, and you can get 1,000 readings a day if you feel like it. But what it allows you to do is get instant biofeedback. So the thing is that if you eat something, you want to know, does this spike my glucose? That's really what you want to know. Now, you can go to the glycemic index, which is an average sort of over many people. And so if you say, does this bowl of cherries spike my glucose? You take 100 people, you measure them, and on average, this is how your glucose goes. But it actually doesn't tell you very much about what yours or mine does, because this is just an average over time. What the CGM does is it allows you to individualize that. So you can see specifically for your own case what this food is going to do to your glucose immediately and over time. So you can check it right away. You can see 30 minutes later, 40 minutes, 50 minutes, 60 minutes. Does it spike up and then go down? Does it spike up and stay up? What does it do? And you can check it every single day. So this is hugely powerful information. Now you're talking about personalized medicine, but you're getting immediate biofeedback, because the thing is, like, we measure these A1Cs, right? And that's a 3-month average of your glucose. But it's like, does that tell you what happened when I ate that bowl of cherries a week ago? Absolutely not. It tells you nothing about that. But if I want to know, I can simply go back in my journal. So this is the power of writing it down and say, what happened to my sugars that day? They were really bad. Why? Well, let me look at what I did. Or maybe you didn't get good sleep. You're tired, you got 2 hours of sleep and so on, and your sugars went crazy. Well, you're not going to know that until you look back and see. That's why it's so important to write it down. And journaling is such a powerful, powerful tool, combined with the feedback of what you're doing. So basically, if you write down what you eat, if you write down what your sugars are, now you can actually make some conclusions, personal conclusions, as to what your own body is doing with any type of food that you want to do. So now you say, okay, well, that bowl of cherries really spiked my sugars and it didn't go down for a while. So now you know I should avoid those. Maybe I should eat blueberries. Now you check. What happened when I ate blueberries? Oh, my sugars did really good. Okay, well, I'm just going to switch, because, I don't, either I can switch one for the other, and then you're going to be healthier. And it's so important, because if you think about how you change behaviors, and this is something we're doing at level 2, is spending a lot of time on thinking about how to change habits and how to change behaviors. And if you think about behaviors, you need immediate feedback, because if you think about anything, so say you're practicing a basketball free throw. Well, what if you practice for 3 months and then I just told you, on average, you made 60% of your shots? Well, that's not very helpful. Like, you need immediate feedback. I throw this ball, it goes in, or it's a little left, it's a little right. Now you adjust. Okay, next one, I'm going to go a little this, correct this. Then you get better. But you don't get that unless you get immediate biofeedback as to what happened when you shot that ball, right? You can't just get that 3 months. And that's how we had been practicing medicine. 3 months later, we tell you, your sugars are great. Well, what did you eat in that 3 months? Well, I ate a lot of stuff. I can't even remember what I ate 2 days ago. So, so this is what the CGM does. But then to take it the next step is to bring it right into, and this is part of mindfulness, is to bring that knowledge that, the CGM and what you eat, and bring it into a very mindful state, so that you're explicitly writing down, because writing it down brings it right to it. And it means you can look back 2 months, 3 months, 4 months. So writing it down in a journal is actually very powerful, because now it allows you to go back in time and say, because people eat a lot of stuff. So if your sugars went crazy, it could be that bowl of cherries, or it could be the baked potato, or it could be this, or it could be that, or it could be that you didn't have any sleep. But you're not going to know until you sort of look at it over time. And that's what the journal is for. So the Diabetes Code Journal is just a booklet to work through. for people, and it's to take that sort of CGM. You don't have to use a CGM, but it's easier to use a CGM than to use the finger sticks, and allows you to write down your foods and your things in a simple notebook that you can just follow. And it's a tool for people to try to reverse their type 2 diabetes.
Yeah, it's so huge because so the continuous glucose monitor is such a benefit, and I think for instance, like what you were talking about, I'm laughing because one day I had to take my wife somewhere. I ran home, grab a couple pieces of meat, we take off, and all of a sudden I look at my CGM, I go, my sugar spiked. I go, what'd you season the meat in? And because I assumed that's what was the problem. And she said, you had that 2 days ago, and did it do anything then? I said, no, it didn't do anything. And then I realized, oh, I grabbed a handful of blueberries on my way out the door. And it was the
Mm.
blueberries that spiked me, right? So I know
Yeah,
then I know, oh man, but I eat strawberries doesn't do the same thing. So fine tailoring it to that person. And also, really, Jason, we're looking at this insulin, I mean, the sugar spike, but we're thinking, what's the insulin doing during this time, right? Because
yeah.
as we know, during strenuous exercise, one of my patients came in, she was, I'm seeing all these spikes. Like, oh, she's a disaster. What's she doing? Well, she was doing Orange Theory workouts. Every time she did OT, her sugars went crazy, right? And you go, oh, that's physiologic. Don't worry about it.
Exactly. So you see that during fasting too. So when you fast, your sugars can also go up. And people always say, how can that be? And it's like, well, if you think about it, it actually makes a lot of sense. Same with the orange theory, right? Because if you're working out, what happens is that your body's going to start releasing glucose, right? So it can store glucose. The body can store the glucose. Now it's releasing it for you to use because you're exercising or you're fasting. So therefore, your body needs glucose as a source of energy. If you didn't eat, where did that glucose come from? Well, it could only have come from your own body. So all that's happening is that your body is releasing glucose for you to use, which is a good thing because that's what you're trying to do. You're trying to get that glucose out of the body so that it doesn't cause damage, right? It's that excess of glucose that's damaging your heart and your kidneys and your eyes and all that. You're basically marinating your eyeballs in glucose, and your eyeballs don't like it, right? They're like, oh God, over 10 years, you get all these diseases. Same with the kidneys. You're marinating your kidneys in all this glucose. Same as you marinate a piece of meat. It just soaks it all in. So your kidneys are soaking it in. Everything's soaking in all this glucose. And the problem over like 10 years or so is that you get this irreversible chronic damage. So it's such a powerful tool because now if you're working out and your glucose is spiking, then you say, okay, one, that's normal. Two, that's good because your body probably has too much glucose and you're getting it out. So you probably actually need to do more of those workouts, if anything. And three, I don't need to worry about the spikes because what's happening is good. But you only know that, of course, from having that data, which is why it's so powerful. And same as what we're doing at level 2 health, which is, trying to put it all together for people. And it's a hopefully be able to bring it to a lot of people. I mean, that's why I'm doing this, is because there's so many millions of people, and yeah, sure, a few of them will watch YouTube and stuff, but then they get, they say, oh, well, I could do low carb and fasting to get rid of my diabetes. Then they go to their doctor or their dietitian, and they'll be like, no, that doesn't work. Go back and take your insulin, sort of thing, right? And it's like, okay, well, now we want to be able to bring it to people sort of where they are and help them where they are. But that your employer has to actually subscribe to it. So
Yeah, and that's the other thing. I was laughing because I remember when I first started this stuff, I call you on like, my sugars were like 129, 132, something like that in the morning. And then all of a sudden they're dropping, dropping, dropping. Then all of a sudden 2 or 3 weeks in, I'm like, crap, my sugars are going up and up. I'm like, Jason, what the heck's going on? Oh, congratulations, you're fat adapter, right? Because a lot of times you're going to get those more elevated sugars. And your first question is like, are you eating a bunch of carbs at night? No. Okay, then don't worry about it. Congratulations, you're fat adapted now, right? So it's amazing because people get so concerned about those high. Like, what am I going to do to lower those sugars more in the morning? Don't worry about it. It's physiologic, right?
exactly. And that's why it's always great to know what's happening over time and what's happening sort of to the glucose. I mean, because it'd be good to know what the insulin is too, but the glucose is the thing that's a lot easier to measure. It's always funny to me, some people are like very against using continuous glucose monitors, and it's to me it's hilarious because I saw this on Twitter and like, oh, you shouldn't be using it for healthy people. I'm like, how do you know they're healthy until you actually measure it, right? It's like,
Yeah,
so it's
that's
like
the thing
crazy.
is
It's
this
like
whole thing.
insane.
And that's the thing is people, it's such a, like for instance, I'll have a husband and wife, maybe the husband's more insulin sensitive than his wife. They'll eat the same exact thing and his sugars are fine and hers go crazy. So
Yeah.
it's that thing where you want to know, how do you personally respond? That's why it's like this personalized healthcare where you can understand now. And I think fasting, the crazy thing about fasting is I think it generally works for just about everyone if they're overweight and struggling. And so it's amazing. I see diabetes. As a matter of fact, just this week, one of my patients was, her sugars are hard to control. She had to fast for her colonoscopy, and her sugars are like in the 70s and 80s the whole time perfectly. And she's like, "Oh," I go, "This is bad news because fasting worked for you, clearly, right?" So it's amazing when you see that though, but it's such a fear. I think food, like you're talking about the mental part of it, how fear, like those of us who are overweight are afraid, like, okay, if we don't eat enough right now, I'm gonna be dead by the time I can eat again. So I have to like keep having snacks and plan their whole day of eating. And it's such a mental thing.
Yeah, and people get worried too that if they don't eat for a period of time, then they're sort of just going to get overwhelmed by hunger sort of thing. And it is a consideration, but in fact, a lot of people are able to do it. A lot of times it's actually more habit than anything else. Like you look at this whole idea that you should eat 6 or 8 times a day, and it's like, if you eat fewer times a day, you just get used to it. And then eventually it becomes easy, right? So a lot of times I don't eat breakfast, but sometimes, I'll have breakfast when I'm, out or traveling or whatever. And then I wind up not eating lunch. So I wind up mostly having 2 meals a day because I had this thing where I went to a hotel and they came with breakfast, right? So it's sort of a waste of money if I don't have breakfast. So that's fine. So I had breakfast, but then I can't eat lunch because I'm too full, right? Because I'm not used to eating breakfast. So it's like, okay, so that's fine. So now I'm still eating 2 meals a day, breakfast and dinner instead of lunch and dinner, and it's fine. But it's because I'm so used to it, and and my family's actually used to it too. So it actually makes it easy. Because I remember as there, and we were like, okay, we're gonna have breakfast, and then they're like, and then I was like, yeah, I was like, sort of, we can go here for lunch, and they're like, oh no, but we're having breakfast. So then, it's like, oh, okay. It was
So let's
just
wait
sort of
for
that,
dinner and enjoy it,
right? Yeah.
right?
So then it's like, yeah, okay, so then we're just going to wait for dinner because nobody was going to be hungry. So it's just sort of, it's developing these habits because everybody thinks it's about willpower, but it really isn't. And this is sort of so destructive, this idea that weight loss and weight gain, it's all about willpower. I think it's actually not. I think that it's about a lot of it is about habit. So if you develop the habit, then you don't have to exert willpower, right? That's a huge benefit. So doing it on a regular basis, and that's what intermittent fasting allows you to do, is sort of build in that habit that, oh, you're going to only eat from here to here. Then if you eat outside that, you can, but it feels odd and it's only going to be once in a while, right? So instead of the baseline being sort of 6 meals a day, and then, oh, you're going to have to cut it to 3, which is hard. Your baseline is 2. Then when you go up to 3, 3 feels like, oh, wow, I ate so much the other day because I ate 3 meals a day, right? So it's really what your baseline is. So if you can set your baseline down, and I think a lot of it too is, people talk about the, ultra processed foods and stuff. And I think that there's a lot to be said about this sort of thing, in that they are more sort of addictive. I mean, I know Jen Unwin talks about it a lot, food addictions, and so on. And a lot of foods which are sort of highly processed do fall into that sort of category, where it can cross the line into addictive behavior, right? And again, the important thing is to understand that if it's an addictive behavior, you need to treat it like that rather than saying, oh, just eat a little less. It's like, oh, that's sort of like, oh, you're hooked on cocaine, you should try going half the cocaine. It's like, that's not very effective, because if you're addicted, you're addicted, right? Taking half the cocaine is not that useful, because eventually you're just gonna go back to your usual habits. You got to go cold turkey, and there's a whole science of addiction medicine that you can almost apply to food, because and it's, again, it's the ultra processed foods, because when the way that it gets processed, you get these huge spikes in glucose, huge spikes in insulin, that are not normal. And we know that. And you get this, so you take these ultra processed foods which have no fiber, and the way they're made, you take them and you see in the reward centers in the brain these giant spikes of dopamine, for example. And it's like, okay, well, people are getting addicted to that, right? So it does sometimes go into that sort of across the line into addiction, which means, again, it's not about willpower, right? It's about understanding and saying, well, and that's where sort of carbs are probably the worst. The highly processed carbs tend to cause these giant spikes, right? Giant spikes in glucose. Whereas if you have meat, you don't get these giant spikes, that come up very fast, right? The same way you do with, say, flour or something, white flour. It just sort of, right? The glucose can just go boom. So
Yeah,
it's
and
it's an
yeah,
interesting discussion. A lot of these things that we talk about.
yeah, and there's data on this stuff with your first hit of sugar, it releases serotonin, dopamine, all these receptors, but over time you need more and more of that stimulus to get the same effect, right? So you need to eat six
Yeah.
cookies. Like some people can have one bite of cookie, go, yeah, that's good, I'm done. Other people have to eat the whole basket of cookies, right? So it's just really figuring out who you are too, and that's why journaling, having all this stuff that you're doing, it is helpful, because then you can look back at what, and then you can look back too and go, oh, I was feeling great a month ago. What was I doing? Oh, here's what I was eating. Here's what I was doing. I was exercising every day and meditating and and now I feel inflamed and bloated and gross because I've been eating terrible stuff during the holidays. And then you can look back and go, oh, I want to feel better. And then you
Yeah.
could reason it out mentally. It's not willpower saying, I don't want to feel like garbage anymore. I want to feel better. You wonder how many people are walking around that are fatigued, tired, depressed, anxious, stressed, and all this stuff. And if they change their diet, it gets better.
Yeah, absolutely. And I think that the journal allows you to sort of pinpoint, like, oh, here I was doing fine, and then you ate, you went away for something like that, or, and then you had a lot of cookies and stuff, and then all of a sudden, you're eating cookies all through. And that's what the journal allows you to do, is sort of pinpoint where the problem, if you know where the problem starts, then at least you can go back and you can see it. And I think the whole discussion about diabetes and remission is also very, very important, because and that's what I was trying to say. It's sort of a workbook for reversing type 2 diabetes, because nobody ever tells you, like, when I tell most people that it's reversed, people are like shocked. They don't believe me, even though the ADA says that. They sort of very quietly said it, because they've been saying for so many decades that it's chronic and progressive, same as Diabetes Canada. They only had criteria for remission in 2023. Like, I've been talking about diabetes about reversing diabetes since like 2013, 2014, right? I was looking back at some videos, and is like, okay, that's like 10 years. They're behind by like 10 friggin' years, which is a long time for a patient, right?
How many limbs are going to
So
be lost, and how many people are going to go on dialysis and all these things. It's
exactly. And that's the other thing I did a bit more the last little bit, is put a lot of stuff on YouTube. That was during the pandemic. I started to put out more stuff on YouTube, because, again, it's a great medium for reaching people, right? Because to me, it's fine to sell a book, but I don't, that's not really, I'm just trying to help people, right? So YouTube is great, because I put the information out, and everybody wants it can see it for free, right? You don't need to subscribe to Netflix. You don't need a cable subscription. You don't need to pay for nothing. You just go to YouTube, and it's all free there for you, right? So, I have, like, I think over 100 videos now on there, and they cover sort of all different things, aspects of fasting and type 2 diabetes. Like, the whole idea of type 2 diabetes and insulin resistance, to me, is just a fascinating one, because and I was talking to some residents that some nephrology fellows who were doing their training. And how in the diabetes code, I talk about insulin resistance, and I really rethought about this the wrong way. And so the way you get taught is that the cell, insulin is a hormone. It allows glucose to go into the cell, and the cell uses it for energy, right? So during so-called insulin resistance, there's a cell, there's glucose in the blood, that there's too much glucose in the blood, there's lots of insulin, so why isn't the glucose going into the cell? And so we all get taught that, hey, maybe something's blocking it, right? So maybe it's like a piece of gum in the lock. So, insulin comes, tries to open up the lock, doesn't open, the gate doesn't open, so you can't go in. So the whole problem is that idea of insulin resistance is completely and utterly incorrect. There's no possible way it's correct, because if insulin is there but insulin doesn't work, then the cell has no glucose. It's going to be starving, right? So it's an underfilled situation. It's going to have internal starvation. That cell has no energy. You're going to have, you're not going to have a fatty liver. You're going to be very, very thin, like emaciated looking. And losing weight is not going to help you in the least. Why would it help you? Your cells are starving already, right? It's like starving and anorexic. It doesn't help. It makes things worse. All of that is wrong. People have big fatty livers, people have abdominal obesity, and losing weight basically cures the disease. We know that. We know that from all the Ozempic data, from all the bariatric surgery data. So this idea is that you have this internal starvation, that insulin is there but doesn't work. It's all wrong. And I don't know why nobody talks about it, because it's completely wrong. Because then if you say there's insulin resistance, something's blocking the insulin receptor, then you ask yourself, well, what is blocking the insulin receptor? And there's no answer. So I asked these fellows, what causes insulin resistance? And remember, these are fellows, which means that they are at the sort of peak of their knowledge. They've been going continuous medical training for 4 years of medical school. They did 5 years of specialty training, right? 3 years of internal medicine, 2 years of nephrology, and they were doing training after that. They just had 9 years of intensive medical treatment. I asked them, what causes insulin resistance? They're like, oh, I don't know. And I'm like, this is what the university teaches you. The most important disease that you are going to deal with, and you have no idea what actually causes it. How are you going to treat it? They're like, oh, I never thought about it that way. I'm like, okay, so you just spent 9 years in a university setting and nobody thought to ask you or question you about what causes this most important disease that you are going to treat in your lifetime. As a nephrologist, that's like 50-60% of your patients, right? So the idea, and so I was telling her, okay, so think about it this way. You have glucose in the cell, you have a cell, you have insulin, why doesn't the glucose go in? Well, the other possibility is that your cell is just so full of glucose already that the glucose can't go in even after you open up the door, because it's full. Just like if you have a sports bar, it's Super Bowl Sunday, it's packed, you open up the door, you can't go in. There's no room. Same thing. Cell is so overfilled that even when insulin is there and opens up the insulin receptor, opens up the gate, the glucose in the blood can't go into the cell because there's just too much glucose in the cell.
And the cell's trying to protect itself, saying, I can't take any more glucose. Like, I'm not
Exactly.
listening anymore. You could yell all you want, but I'm not letting anyone else in.
It's dangerous. I can't let anybody else, right? Just like the room. Like, there's a fire code, can't come in. Same thing with the cell. It's dangerous. I have too much glucose. I can't take any more. Sorry, go away. Then the glucose piles up outside the cell. Then you think about it. What's going to happen? You're going to have a big fatty liver, right? These are the predictions from your theory. You're going to have a big fatty liver. You're going to have abdominal obesity. Your liver is full of glucose, so it's going to turn it into fat through de novo lipogenesis. So therefore, as it turns it into fat, you get fatty liver. Then as you get fatty liver, your liver wants to get rid of the fat. So what does it do? Well, it sends it out as VLDL, which is triglycerides, right? Because it's trying to get rid of all the fat that's in the liver. So now your triglycerides go up, and therefore your HDL goes down. So what do you have? You have low triglycerides, low HDL, high triglycerides, high blood sugar, abdominal obesity. That's 4 of the 5 criteria of metabolic syndrome. And it's going to predict, this overflow theory is going to predict that losing weight is going to cure all of those diseases, which it does. So it fits perfectly in. And yet none of these fellows that are trained at the university actually have any idea that this is what's happening.
Well,
and
because they're like us, Jason, for all those years, we're looking at what's the sugar doing. So if I can shoot you with insulin, lower your sugars, go, oh, I'm helping you. Well, where's that sugar going? It's going to your liver and tissues. right? So
Exactly.
you're taking and it's by the same analogy you were using with the sports bar. All of a sudden what they're doing with the new GLP-1 agonist is like, oh, let's just open more rooms. That will fix the problem. And then you grab all
Yeah.
those people and put them in different rooms. Now you have more fat tissue, right? And you're losing muscle mass at the same time. So people don't realize the long term. And I'll tell you, one of the biggest things, and I don't know if you even remember this, is on Twitter, everyone has started attacking you one day. And I was like, this is weird. Like all these guys they're kind of in this pack were attacking you. And I'm like, this is like you guys are, and it was like not very nice at all. Like they were dressing up like a clown doing crazy stuff. And so I go, hey guys, this is disrespectful. And so guess what? All those guys I've seen now over time, that was the week before this new drug came out, right? That they're
Oh,
touting for the cure to obesity. You don't have to fast, you don't have to change lifestyle, just shoot this drug. This guy's Jason's crazy. Don't listen to this guy. And all those guys now are having, $99 a month, and I'll shoot you with this drug. I'll prescribe it for you, $99. So they're like charging all these people for this drug, saying you could just shoot this
yeah.
drug and like you don't have to change what you're doing. And it's the same thing with insulin. The endocrinologist forever would say, oh, screw Dr. Lenskis and Dr. Fung, just shoot more insulin. I'll just go up and up and up on your insulin. Your sugars will be fine. You don't need to
Yeah.
change what you're doing. Eat your cookies and dough. You can do whatever you want. You have a get out of jail free card, right?
Yeah, these drugs are actually very interesting because, everybody, I talked in the obesity code about insulin, right? And I kept saying, if you think about it, if you're looking at the causes of obesity, what causes people to gain weight, right? We're talking about causal links. I always said people always overthink this because they always talk about fat or whatever. And I was saying, no, insulin. Insulin is a cause of obesity. Why? Well, there's only one true test of causality. You give it and you look for the result. So if you give insulin, do people gain fat? Like 99% of people do. If you give enough insulin, almost everybody can get fat, right? If you take away insulin, do people get thin? And again, same thing. It works like 99% of the time. You look at, and it's not that easy, but insulin is, you get this deficiency disease called Addison's disease, and you get very low levels of insulin, and people are like emaciated again, right? Or you have type 1 diabetes where you take away the action of insulin, or you take away the insulin, people just lose weight like crazy, right? So therefore, if you give it and they gain weight, and you take it away and they lose weight, you have a causal relationship, right? It's not just an association. And everybody always says, oh, no, it's not causal. It's like,
It's bad. You even said that. You go, if you want to make anyone in the world fat, you can take the skinniest person on earth. You run IV sugar in one arm, insulin on the other arm,
insulin,
and see what
yeah,
happens. It's a no
100%.
brainer. It's a no
It's a
brainer.
no-brainer. So insulin we know is a cause. It's not the only cause, but it's one cause of it. So then you have to ask yourself, okay, how am I going to lower the insulin? And people say, well, the GLP-1s, I remember people were saying this. And I generally don't respond on Twitter because I try not to say anything
Yeah, you have better
negative on
restraint than
social
me. I know. I'm trying to be like you, Jason,
Yeah, I'm
and
trying to
Dr.
be like
Unwin.
David Unwin. So
Yeah.
and David Ludwig, both of those guys are great. But the thing is that they say, oh, well, this totally disproves the insulin hypothesis. I'm like, first of all, there's no hypothesis. Give insulin, gain weight. That's not a hypothesis. That's just fact. Every single patient knows that. So if what they said with the GLP-1s is that, well, hey, the pancreas secretes more insulin with the GLP-1. So this totally disproves that. I'm like, oh God. The thing is that when you give a high enough dose of the GLP-1s, then not only do you get that rise in insulin, but which should cause you to gain weight, but you get this severe anorexia, which means that you don't feel like eating. And this is the central nervous effect, the effect on the central nervous system of the GLP-1. And that basically makes you not want to eat. So you talk to anybody who's taking Ozempic and they're like, I can't eat. Like, I just can't, right? I'm nauseated or I have no appetite. I eat one French fry and that's it. I'm done. So if you have severe appetite suppression, which causes you to not eat, over time, your insulin levels go down because insulin is a nutrient sensor, right? So therefore, if you look at any study of GLP-1s, insulin levels go down a lot. So even though it causes insulin secretion, the total effect on insulin is that it goes down like massively, like massively. So therefore, it completely proves the hypothesis. You take down insulin and you do it by suppressing the appetite, centers in the brain. And it totally proves the hypothesis that the mechanism is you suppress insulin, you lose weight. So it's really as simple as that. The problem with GLP-1s is that, people tout them as these miracle drugs. And they're pretty decent enough drugs. They're a lot better than insulin, I'll tell you that. But a lot of people don't stay on them. And there's a good reason why. It's like if you take away all pleasure from eating, well, that's fine. You can do it for 6 months, but can you do it for like years? Because you know that it's one of sort of life's great pleasures, right? So people mostly enjoy the same things. And this is true all over the world, right? People like to get together. People like to have friends. People like to have family. And all celebrations are generally food-based, right? You have a big celebration, you have a big dinner, right? So fasting is sort of part of that natural feasting and fasting, right? You fast when you want to lose weight, but you feast when you get together, want to have a good time. If you take away all enjoyment of food, that's a huge hole in your life, right? Like you talk about your life and living a full life, enjoyable life, right? Having friends, having families, being healthy is a huge part of that. But food is a big part of what makes us sort of human, right? We get together with friends, we go to a meal, we get together at celebrations, we have a meal together, right? It's just part of being human. If you take away all of that, it's fine. So I always think like it's a fine enough drug. I don't mind it at all. But I remember reading this article in the New York Times saying that only about 30% of people stay on it at 1 year, right? And cost aside, I can sort of understand why. And I've been using these drugs for about 4 or 5 years because in Canada, the Canadian government, we have a sort of a socialized medicine. So certain drugs get covered. So this drug got covered for us in 2019. So therefore I could prescribe it and people wouldn't have to pay for it if they're over 65. So it was much better than insulin. So I switched a lot of people, diabetics on it. And it's a good drug, but it's not a miracle drug because, if you think about the typical time course, so say you have diabetes, you're overweight, you take the drug. Great. The first 6 months, amazing. You're losing 20, 30 pounds, right? So that's great. You're a little nauseated. You don't enjoy food. Your appetite goes way down. But you're thinking, okay, well, that's all right. So everybody's saying how good you look and stuff. Okay, so 6 months later, your weight stays the same because, weight doesn't go down forever. You've lost your 25 pounds. You're keeping it off. But, nobody's saying how good you look because you look the same as you did 6 months ago, right? And you're still not enjoying your food at all. Everything tastes like crap. You can't enjoy yourself. Every time you go out to a meal, every time you go out with friends, you're enjoying the company, but you're not enjoying the whole thing because you know how when you go out with friends, oh, you're having a meal together.
Yeah,
Oh,
if
you're
you have a
having a
stomach
great
flu and you're going out
burger.
with people, you're like, okay, nothing sounds good. Yeah, exactly.
Exactly. So you're missing this whole thing. You're not losing any more weight. Your weight is just stable. A lot of people and people talk about this sort of muscle loss. It does happen. I mean, it's you see that in the studies, but you hear it anecdotally as well. Some people are like, "Oh, I lost too much muscle," and to some extent, it is true. But then after a year, a lot of people start to go, well, I can't take this. I don't enjoy anything. Like, I can't enjoy any meals at all. Like, every day, I just don't enjoy eating, right? You've taken that away. So it's it's an okay drug. Like, it works okay, but can you really take this for 2, 3, 4, 5 years? And then if you haven't learned how to manage your weight, then the minute you stop, like literally the minute you stop, that weight comes rushing back, like really fast. And again, all the studies show this.
Yeah, it's
So
devastating,
you
man.
keep it off for like 2 years, right? You keep off 25 pounds for 2 years. Amazing, amazing, amazing. Well, now, you start at 40, at 42, you decide, I can't take this anymore. I don't enjoy food. I haven't been enjoying food for 2 years, so I'm going to stop. Now your weight goes back up within like 3 months. You're actually back to
Especially if
your
you've
old
lost some
weight.
muscle mass and you have more fat cells to fill up, right? Your body's going
Yeah.
to fill those up.
Yeah. So it's not as I said, I do prescribe it a lot for diabetes because it's better than the alternatives, like
Yeah.
the insulins. They just aren't that good for you. But is it a miracle? I don't think so. Is it? And people are always, I always
It's
think
a
it's
tool you have to
funny.
use appropriately, right? If you say, hey,
It's
if it gets you on track and helps you with your cravings to start with, things like that, and I think that's it is it's
yeah.
such a hard thing, and it's funny, sitting down with you, Jason Fung, Ben Bickman, Jason Fung, yeah, I'm thinking of Sean Baker, everyone says these guys are fanatical and you talk to every one of you guys and you go, okay, do what works for you. Ultimately,
Yeah.
if it doesn't work, then don't do it. You've always said that. And it's amazing how
Yeah.
we get pigeonholed into certain things and go, oh, these guys, say you can never eat bread ever again. It's like, well, some people maybe, but a lot of people can eat bread and be fine. Ben Bickman could have some bread and be okay. And Sean Baker
Yeah.
probably could too if he wanted to.
And I think that the whole idea is that you have to understand sort of what is the problem, and that's where personalizing a lot of these diets and stuff can be very useful. Writing it down can be very useful. Understanding, and this is what always gets me is that, to me it's not about, I rarely tell people, oh, you must do this, you must do that, because I don't really care, right? Like, I always say, like, I tell people, I try to educate people and I try and tell them what they could do, what they should do, but I'm not their mother, right? So I'm not going to like harangue them about eating a bagel. It's like, that's not my job, right? If you want to, you go ahead. If you don't want to, you don't go ahead. I'll tell you what, if the bagel, if you're diabetic, will spike your glucose. That's just what happens. But if you want to do that, that's not my problem, right?
Well, and that's why the
So
CGM is so powerful too, is because you can see it, then you can make a decision. Some people are competitive. A lot of people are competitive. They go, I just don't want to see it. I'm playing a game to see how flat I can get my sugars and other people are like, I don't want you to see it. Like I would have that
yeah.
bagel and I don't care if my sugar goes up a little bit, but I don't want you to see it when we have to go back on Wednesday and you go, what happened on Tuesday? Right. And so there's all that happens. There's so much to this. And I love that you mentioned mindfulness because that's something over the last year I've been really looking at is the effects of stress. I have people all the time, and I don't know if you see this, but I have people all the time. They go on vacation to Italy for 3 weeks and they lose 10 or 15 pounds and they're eating
Hmm.
pasta and bread and doing all this stuff. And I don't know how much of it is because their food's less processed or whether they're walking more or whether it's the stress reduction part of it where they're just enjoying life and having fun and not worrying about, having to deal with the boss and, deadlines and all that kind of stuff. But it's amazing. And I don't know what you're seeing on the, looking at more continuous glucose monitors. I'm telling you, I see people like one of my patients, her sugars are running in the 80s and 90s. All of a sudden, it's like at 140 all day. It's flat like this all day. And then it spiked way up and it came down an hour later, like below baseline. I'm like, what the heck was that? I don't know. Like, do you have an IV of sugar going in? What did you do? Just I was fasting all day, but I was stressed about this talk I had to give. And as soon as the
Ah,
talk was over and the question and answer, her sugars dropped. Like I've seen it on myself. If I'm giving a talk at an event, my sugars go up because I'm like, you get that fight or flight adrenaline or get really excited about stuff. So it's kind of cool to see the effects of stress and sleep deprivation, and you can say, okay, this is not just about what we're eating. Plus, if you're sleep deprived, you're going to make your frontal lobe gets overruled and you start making poor food choices when you're stressed and tense and you're trying to get relief from not feeling great.
yeah, yeah, I agree. I mean, the whole thing is just a very interesting, sort of more, more information is always good because it allows you to make sort of better decisions, right? Whether or not you want to make a decision, at least you have the information to make that, right? And that's why I always think it's always very strange to me. Like there's this whole debate somewhere, I can't remember where people were saying, oh, you shouldn't use a CGM for non-diabetics or normal people. And it's like, that is just the most bizarre argument I've ever heard, right? And they're like, oh, because they might get worried. And it's like, okay, so the problem is not the information. The problem is that they're not educated. Same with these blood pressure monitors, right? So you'll remember, like, you know, 20 years ago, there was none of these blood pressure monitors that were everywhere now, right? So you wanted your blood pressure done, you had to go to your doctor. That's the only place that had a blood pressure monitor. And so you didn't know what your blood pressure was. Now you have these home monitors everywhere. They're in the pharmacies, they're in the Walmarts, they're everywhere. So now you can make a decision. You can check your blood pressure and say, oh, wow, it's 140. I need to see my doctor and get my medication adjusted. It's 150, 160. So now that you have information, you can make a decision. And it's just about educating people, right? So if the problem is not the information, the problem is that people need to know how to use that information, then teach them. Don't say, don't use the information. Like that to me is
Exactly.
like the dumbest argument. And you see it, like I've seen it a few times. And I always think you know, what is the problem? If the problem is the interpretation, then you educate. If the problem is the information itself is incorrect, then fine, then you shouldn't use it. But that's not the problem at all. So they're looking at the problem. The problem is people don't know how to interpret this information. They shouldn't have the information. It's like, yeah, that's totally the wrong way to think about things. So
Yeah.
it's an interesting discussion, I think.
One, it's an amazing thing because fasting insulin, 99% of doctors, including myself for, 16 years till I met you, never check insulin, fasting insulin, because they don't know what does it mean? They don't know what it
Yeah,
means. But when you're looking at this insulin and A1C and you start saying, oh, okay, they're made because, we see people whose A1C is 6.3 and their insulin is 1, right? And
yeah,
then you see other people at 6.3 and their insulin is 58. And you go, oh,
yeah,
okay, these are, but basically, either one of those people, like the one who doesn't make enough insulin, if they're fasting and get more insulin sensitive, that little bit of insulin they're making has more bang for its buck. And then the one whose insulin super high, we try to, I mean, really the treatment's the same for the most part, just trying
same,
to,
yeah,
ultimately, we want to be I think what Ben Bickman's talking about, what you're talking about is being as insulin sensitive as you can, you know? So I'd love
yeah.
to do a
And
quick, oh, go ahead.
I was thinking about the fasting insulin before because it's such a strange situation where, so with pre-diabetes, right? So there's this whole, if you look back at type 2 diabetes, there's this whole, usually people go through sort of phases. They don't go from normal to diabetes like right off, right? So usually there's this whole period where the glucose is slowly rising, but your insulin is rising to keep that glucose normal. So your glucose actually stays really normal, but you have this insulin is going up. So that's the compensatory hyperinsulinemia. So insulin goes up 10 years before the glucose actually goes up because the insulin is keeping the glucose down, right? So it's like, okay, well, if you're thinking about this and you want to do preventative medicine, well, what makes the most sense? To just look at the glucose or look at the glucose and the insulin? Because you're going to get a huge clue to whether how sensitive you are to the insulin just by looking at the level of the insulin. So it's like, duh, of course that makes sense. It's like in every medical textbook in the world. It's like basic medical school 101 sort of thing. 10 years before you get the diagnosis of type 2 diabetes, your insulin has started to go up. So why are we not measuring that? That makes no sense at all. Like insulin is the key to the whole thing. And yet we're like, oh, don't even measure that. It's like, that's insane.
It's
Like,
insane too. Like I have a patient I just saw yesterday. Her A1C is 6.4, and her doctor says, "Oh, fine, you're fine. You don't have diabetes yet." I go, "Have they checked an insulin?" No, I get the insulin is like through the roof. And I go, "Look, they're waiting for you to get hit 6.5. Now you have a lifetime diagnosis, even though now we could say you're in remission or reversing it. But now you go for life insurance. Guess what? Your all your stuff's going to be way more expensive, at least in the U.S. So you start
yeah,
looking, it's like, why wait till someone? It's like if you it's like having a colon polyp and you go, oh, let's wait till you get cancer and then we'll treat your cancer. It's like, well, let's treat the polyp first. It doesn't make
I
it, let's get rid of
know.
that. And
Makes
so they
no
don't think that way
sense.
with diabetes, and it's absolutely mind-blowing. There's huge institutions in the US where they refuse to check an insulin. They won't do it.
Oh, yeah, yeah, yeah,
And
for
you go,
sure.
wow, it's amazing
You know why?
how
Because none of the universities have talked about it. So they consult. Oh, I'm going to consult this, university professor, and the university professor is like, well, I've never done it and I've never heard of it, so therefore it must be bad. So therefore, like, there's no
I'm
point
not
to it.
looking into it.
Don't pay for it, right? And it's like, okay, well, maybe think about this for a second and do the study if you want, because everybody knows that you can pick it up 10 years before. And so if you can pick it up 10 years before, why would you wait to treat it? Like just like the polyp, you can pick up the cancer 10 years before it actually becomes cancer. Well, you can pick up the hyperinsulinemia, which is putting you at risk of diabetes 10 years before you actually get the diabetes. So why are you not picking it up 10 years before? Then you can actually start talking about, hey, what are the proper foods? What are the proper things? Try and lose some weight, try and do more exercise, do this, do that, right? Now, when you actually know, you can do all kinds of stuff and people are motivated. They want to stay healthy. They don't want a diagnosis of type 2 diabetes. So it just blows my mind, some of this stuff. It's like, it's pure common sense. Like you don't even need to know any medicine. You just need to have a bit of common sense and logic to say, the problem is that insulin's high. Well, I want to check insulin. Okay, well, sounds pretty logical to me.
Yeah, it's just wild because I think people just get into a paradigm and they either arrogance, they don't want to change their tact, or they just don't have education. And it's amazing because when you talk to someone for a few minutes, it makes sense. You talk to a person and you go, okay, if you're shooting insulin every day, breakfast, lunch, and dinner, and you get to breakfast, you can't eat, do you shoot insulin? Well, no, because you get low sugars. Okay, then once you eat low carb or you fast that morning until lunchtime or dinner, how much insulin do you need till that time? So it's amazing when they start saying, oh, what do you base your insulin dosing on? How many carbohydrates you eat? And then the diabetes educator goes, oh, it's crazy if you cut out carbs, you'll die. Right? It's amazing because you're basing your insulin dosing on that if you're type 2 diabetic and you have to shoot if you're insulin dependent, right?
It's bizarre because it's like, again, if you say to somebody, okay, you have type 2 diabetes, your blood glucose is too high. So imagine this is all you know. My blood glucose is too high. And then dietitian says, you should eat carbs, which is the one food, the one macronutrient, which is going to push up your glucose more than the other two. And you should eat more of that. You'd say, what? Why would I do that?
Yeah, you're
It makes
allergic to
no
peanuts, so you have to eat
sense.
it a little bit all day long, right?
Yeah.
Just don't eat peanuts if that's your problem, if you're allergic to it, and not take your Benadryl and anaphylaxis medicines. So let's do a quick lightning round, right?
Okay.
How many people have you treated as a nephrologist for purely eating too much protein going to kidney failure?
Oh, that'd probably be zero.
Yeah, it's such a fear. And I have these middle-aged women who are freaked out. They go, hey, try eating more protein, cutting your carbs. You're diabetic. Let's try to. And they're like, oh my gosh, I'll go into kidney failure. And I'm like, well, Jason kind of knows a little bit about the kidneys and he seems to be okay with it.
Yeah, it was an old, like it was from 20 years ago. We used to say, oh, eating too much protein puts all this pressure on your kidneys and then you could have kidney damage. Yeah, we don't really even follow that. Like even for people with kidney disease, we don't limit their protein. In fact, by the time they get on dialysis, we're telling them to eat more protein.
Yeah, I remember you did the analogy with the sieve too. And you're like, okay, if you have a hole in your sieve and grapes fall out, if you put 10 grapes in, more grapes fall out than if you put one grape in. But just because grapes are falling out doesn't mean you're damaging the sieve,
Yeah. Yeah.
right? Same
It's
thing
the
with
same
sugar,
thing.
right?
Yeah. Same
The
thing
more
with the
sugar you eat, the
sugar.
more you're going to pee out, or the more your body's going to try to get rid of and keep a balance. So fasting, people, one of the big questions they'll say, if I have a cup of coffee and I put a little bit, like 1 teaspoon of heavy whipping cream, do I break my fast?
I don't consider that as breaking the fast because again, one, cream is mostly fat. So the point of fasting for weight loss is to lower insulin, right? Insulin causes weight gain. So you want to fast for losing weight. You want to lower insulin. So if you put a little bit of cream, it's mostly fat, which doesn't really spike your insulin. So that's fine. Even if it does have a little bit of protein, which is going to spike your insulin a little bit, just remember that if your insulin's coming down and down and down with the fast, and then you take a bit of cream and it blips up like microscopically. Well, it's so little that in 10 minutes, it's going to keep going down, 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 down. So it's like technically you might say, okay, you broke the fast, but really it doesn't make much difference.
All right. Yeah. And that's what, because some people are very purist and they get all, worked up. And
Yeah.
it's probably the stress of worrying about it's going to be worse for you than having a low cream in your coffee in the morning.
Yeah,
Uh,
exactly.
what about people with chronically elevated insulin levels? They're doing fasting, they're cutting their carbs on, their insulin's still running high all the time. Is there any tricks for that?
That's a tough one
Stress and
because
sleep and pain, I know, like will do
yeah,
that.
yeah, and then you really have to look then at the foods that they're eating as well, because obviously the one thing is that like smoking, you can completely cut out smoking, but yeah, you can't actually completely cut out foods. You still need to eat. It's just about balancing the feeding and the fasting. So if it's chronically elevated and you're doing the fasting, then you have to look at the foods that you're eating. What is it? Maybe there's something there that you're taking that is really keeping it up. And it could be anything really, because insulin's a nutrient sensor, so it does go up with protein, for example. Dietary fat, not so much, but on the other hand, a lot of these things are individual. Like people respond differently, right? So we see this with diets too, right? You put somebody on a low fat diet, one person will lose 20 pounds, another person will gain 20 pounds, right? So it's the same diet, but the reaction is very different. So you have to individualize it. So yeah.
Would you say the same is true? Like, is there an ideal fasting window for people? Like, if you do, like, if you're gonna every like once a month or twice a month do a fast, do you think there's a law of diminishing returns, like after a 36, 48-hour fast, or do you think it's individualized also?
I think it's also individualized, although it's also personal preference. Some people may find that the shorter, frequent fasts are better. Other people like the longer fasts, and I think either is perfectly acceptable. To me, it doesn't matter. I mean, as long as you're hitting your goals. Personally, I think that the longer fasts are a little bit easier. I actually, except socially, they tend to be very awkward. If you're going out or if you're, meeting somebody or something. Um, or having dinner with the family, it's a little awkward. But personally, I think that they're actually underutilized in the treatment of disease because I think that they're much more powerful. I think that,
When you say longer
because
fast, you're talking about like a 36, 48-hour fast
yeah,
type thing. Yeah, yeah, something
yeah,
like that.
sort of
Okay.
like 2, 3, 4 days,
All right.
sort of thing. So I find that those are very useful for getting people down quickly. You see this in hospital too, where people get sick and then they don't eat, and all of a sudden their sugars sort of completely normalize and they're off all their insulin, right? So it can be very quick, the sort of benefits with that, and it's not as hard as most people think it is. And because a lot of people don't do it, I think that that's something that's useful to try. Like 16 hours is fine, but it's not that powerful, right? But if you go to like 4 days, it is very powerful. So you have to be a bit more careful with it. But on the other hand, if you have a lot of weight to lose or sugars are very high or whatever, it can be a very useful tool.
And I have to ask you, man, this is life's best medicine, and low carb MD people will be able to hear it too. What's life's best medicine for you? What's your motivation? What gets you, where do you get your joy? What's life's purpose for Jason Fung?
Um, I think it's really just helping people. Sometimes people will come up to me and they'll say, "Oh, I read your book, or I listened to your video, or on YouTube or a podcast or something like that." And I had, it actually just happened yesterday. It's like my A1C was like this, and I was on medications, and now it's back to normal. So thank you. I'm like, oh, that's amazing, because this person, I didn't even know this person. And they basically turned their whole, from a health standpoint, they really turned their life around by getting rid of that type 2 diabetes. And all they needed was a little push, a little knowledge in the right direction. So it feels good. It feels good to be able to help people like that. And that's really the best thing. Like I'm not trying to push people to do it. I mean, obviously in my clinic it's different because they're seeing me as a doctor, so I do push them a little bit more. But it's great to be able to help people. I think a lot of people are like that. Like you find that a lot of people, after they've gotten through a little bit, have some life experience, then that sort of helping is very gratifying to people. So I think it really helps me motivate me to read about stuff, learn about stuff, and also teach about stuff and try to help people that way.
Yeah, because you've touched all these different aspects, the cancer code, diabetes code, obesity code, and it's amazing how how many lives are influenced, and not only that, it's how many people that you've impacted that are now impacting tons of patients, right? I have so many people I talk to. Oh, I spent like 6 weeks with Jason's clinic. He just opened up the doors and let me in, and you were never one to back down and say I'm not helping. I don't want everyone to know my secret of what I'm doing, right? And so it's amazing that these guys, same guys who were attacking you for a while, these same guys, I've never heard anyone say, yeah, I heard this person and they saved my life or they changed my life. But I hear it every day about you, so I
Oh,
want you to know
thanks.
that the impact. And even low carb MD, we're going to call it two keto quacks. And you're like, I don't think that's a good idea, guys. And you help to get off the ground. But I mean, your wisdom of that of saying, okay, you can't take sponsorship, even though we're like going broke because of you, man. But that's all right. But I think is that what? But you've been
Uh,
a beacon of integrity and saying, hey, look, if it helps people, good. Like whatever I learn and all the stuff you do for free online, YouTube and all this. And I always say, go look at YouTube or go look at different places where you're doing everything for free. You don't get paid for that, but
yeah,
it's
it's
just
all in the
getting
blog.
the
It's all in the like you could buy the book if you want, but it's really all out there for free if you want to dig, right? Obviously, the book I put it together, and then the publisher helps get it out there. But really, it's all out there. Like the YouTube is free, the blogs are free, all the information is in the blogs or the podcasts or wherever. So it's everywhere available for free. And sometimes I get, I rarely respond, but it's like sometimes people are like, oh, this and that, he's taking this and that. I'm like, I don't take anything. Like there's that tea. And then it's like, yeah, but I don't like I thought it was a good thing. Like one, actually the tea is terrific. So I said to those guys, I said, can you make me a fasting tea? Because I think people will really be helped. So they made it for me and they sell it. I don't own a piece of the company. I don't own partnership in anything, right? I don't get any money from it. I did, but I think it's great. I think green tea is great. I'm not sure what's wrong with saying I think
well,
green tea is great.
and
And I,
if it's not a conflict of interest, it's something that you believe in. It's not like, oh, green tea doesn't do anything, but I'm going to promote it because I can make money. It's one of those dang things where my life's best medicine is sponsored by Keto Mojo and Health Code because I love both of the companies, I love the people, and I
yeah,
use those tools in my practice every day. And I
yeah,
see the readings, I'm looking at the CGMs, and so these kind of things you start looking at it and you go, okay, I have no conflict of interest. Low carb MD, we chose not to take any conflict of interest at all because we don't like you don't want the appearance that you're just sold out to people because everyone's sold out in medicine these days. And if you don't
yeah,
love the money and you want to help people, it's kind of a nice thing. But there's tools that are very helpful to our patients. And you go, okay, if a fasting tea helps you fast, cool. You're going to be healthier. Your
yeah,
insulin's
yeah,
going to come down. You're going to get, we're achieving our goals. But I think it's so hard for people and I think it's because there's so many people out there that are grifters is they assume everyone's like them.
yeah.
Yeah, and they kind of just make that assumption and guilty until proven innocent type thing. So yeah, I
Yeah,
appreciate
I
everything you're
mean, that
doing.
company anyway has switched over a little bit more towards like skin and beauty and stuff. So that I don't even know if they promote it that much anymore. But for a while it's a tea company, but now it's more of a whole beauty company and skin stuff. So I actually have not that much to do with them anymore. But that was the whole story behind that. But I got attacked a lot on that, and I don't care. Like if people don't want to listen to me, don't listen to me. Like I'm putting it out for free. So if you don't want to listen to me, it doesn't matter to me particularly.
But it's
But I think
amazing.
it's helpful for people. That's all.
Yeah, it's amazing how many people now are doing, time restricted eating or fasting, and they just kind of naturally grab. And that's what I find is most people naturally gravitate to that because I don't think there's anything that will make you as insulin sensitive as doing fasting because it's going to lower your insulin,
Yeah.
right? So
Yeah.
if we're trying to achieve those goals, you say, okay, what levers can I pull, right? And so I
Yeah.
think the other thing is you and Dr. Unwin, a lot of these docs have given people hope again to say, yeah, this is a reversible condition.
Yeah.
And so they don't say, well, there's nothing I can do about it. I'm just going to, medicate. And we've all seen the disasters of amputations and blindness and, kidney failure and depression and dementia. And you go, well, if I can intervene on that, that's what we're called to do. And we're making a difference. So I thank you for all that you've done. It's ridiculous. It's amazing how many people you've influenced around the world. From everywhere I go, they're like, "Oh, Jason Fung. Yeah, I know Jason Fung. Everyone knows you. More people know you than know anyone else in medicine." So it's remarkable what you've accomplished and standing strong by those early attacks. And when you threaten the system, it's really a scary place to be. And you're not afraid to throw rocks every once in a while.
Yeah. I like to. I actually like the puzzle of it. So obesity was about sort of like thinking about it differently, right? As opposed to calories, I was saying, think about it from a hormone standpoint, because our bodies run on hormones, right? And that was the sort of point of that with diabetes. It was like, don't think about type 2 diabetes as insulin resistance. Think of it as an excess of glucose. That's really the whole thing. And therefore it's then reversible. You have too much glucose, put less in, or increase, take more out, right? Simple. But it's completely the entire sort of paradigm of thinking about it, obesity as a hormonal disease, imbalance, as opposed to a caloric imbalance. Took a lot of heat for that, of course. The diabetes as a reversible disease, right? And then cancer, the cancer code is actually my favorite of them, because I actually think it's the most interesting. But it's like, don't think of it as a genetic disease, think of it as an evolutionary disease. And I think that entire thing, I mean, people are, because it's relatively complex and requires a lot of sort of thinking, it probably is less accessible to people, but I actually think it's the most interesting, because I think cancer is a very interesting and devastating disease that requires more understanding to get more research. But to me, that was that sort of evolutionary paradigm of cancer is completely fascinating. Like, does it change anything in terms of treatment? No, and that's probably why it didn't. It wasn't as I don't talk about it as much. But on the other hand, I think it's just fascinating.
And there's more science and more data coming out all the time. And people go back and, wow, what he was saying was true back then. If you think about getting a PET scan, you inject people with sugar to find where the cancer is. And you go, okay, that's kind of tells you something, right? So, and all these things with metabolic and mitochondria and all these things that we're starting to learn, there's so much we just don't understand. And saying, okay, when we intervene these ways, people do better. And when you start seeing your patients get healthier and better, it's so rewarding. That's what we went to medicine for.
Yeah,
We knew
yeah,
we weren't going to get
amazing.
rich being in medicine, but you were going to design jet airplane engines. I know, if you didn't do this. And it's crazy. Ben Bickman was going to do some other crazy thing. You're like, just think you two guys go different paths. Where are we at in medicine? It's pretty amazing. So Jason, if people want to track you down, where do they find you, Dr. Fung?
You can find me on Twitter. You can find me on YouTube. So just look under my name. I think it's Jason Fung, not Dr. Jason Fung. For a while, there was some copycat person who had that, but just look under my name. I also do some blogs on medium.com, which it used to be free. I think they changed it, but I maintained my blog there so for a number of years. So I think it's like $5 a month or something. They used to give you like some free articles, but I can't remember. They might have changed it. But then the other day somebody said, yeah, it's all accessible. But you can go there as well. So and then the fasting method is the program that Megan and I run, which is more of a paid program for counseling with regards to fasting and so on.
Awesome. Great information that I've had patients greatly benefit from that and they love it. So thanks for all you do. And everyone, hey, this is an absolute honor having Dr. Jason Fung on. Remember, be kind to yourself, be kind to others. And, sometimes you have to think outside the box and fight the paradigm and the narratives that are out there. And if you're struggling with these kind of diseases, at least grab his book, take a look. I'm telling you, I have it in my office. I have all my patients read it, all of the books, so I think it's just relaxing a little bit, take a breath. There's things we can do and just use some common sense. Even if all the experts are wrong, there's good sources of information out there, and a lot of it's free on YouTube and all these other places. So Jason, hey, thanks so much. Great seeing you.
Thanks so much.
Thank you for listening to this episode. We greatly appreciate your support. We would greatly appreciate a positive thumbs up on all of the platforms like iTunes and Spotify or wherever you're listening. And we just thank you for our Patreon supporters. We greatly appreciate your help in getting this message out. We think there's a lot of important information. And hopefully this helps you. Have a great day. And thank you for listening. And thank you for your support.